The future of healthcare innovations evolved based on understanding the healthcare challenges. Welcome to Samsar. Like Albert Einstein said, the world will not be destroyed by evil, but by people who watch it without doing anything. My mission is to collaborate with the 7 pillars of our community. They are mother, teacher, father, doctor, employers, peers, and spiritual leaders. As we navigate the complex landscape of modern healthcare, we must confront urgent challenges, including antimicrobial resistance and the pitfalls of hospital-centric care, shaping the future of medicine. Let us explore the core themes. 1. Post-antibiotic future presents a critical reality where antimicrobial resistance has escalated beyond projections, challenging our healthcare systems and demanding innovative approaches to infection management. 2. Hospital-centric care failures. Hospitals have emerged as dangerous nodes during outbreaks, highlighting their inherent vulnerabilities. This shift necessitates a reevaluation of care delivery to enhance patient safety and outcomes. 3. It's not a disease or infection, but fear can undermine rationality, leading to poor decision-making during crises, where panic often exacerbates the situation more than the disease itself. This highlights the need for calm, informed responses. Clinical anxiety and life management is the cognitive-assisted, life-saving, compassionate, accurate, and logic-based medical triage. The color-coded triage system has evolved since the 1980s, offering a simple yet effective method for prioritizing patient care under stress, ensuring that critical cases receive immediate attention. Loss of intuition shifted modern medicine. Today's healthcare often reduces doctors to checklist-driven tasks, undermining their intuition and clinical judgment, leading to a less personalized patient experience and increased reliance on protocols. Patients as recipients. Because the patients are viewed as passive recipients of care, which disconnects them from their healthcare journey, diminishing their autonomy and engagement in treatment decisions. The reduction of doctors' roles and intuition in modern healthcare workflows has led to significant challenges in delivering personalized care and maintaining effective clinical decision-making. The shift towards automated decision-making in healthcare has led to a concerning trend: patients becoming passive recipients of care, lacking engagement in their own health journeys. Collaboration journey with us. Initial discussions highlighted the need for a cohesive framework to address healthcare challenges effectively. A shared commitment emerges, emphasizing the importance of ethical standards in developing healthcare solutions. The team faced challenges translating discussions into action, motivating a stronger focus on practical encoding. Shared insights are: reasoning must depend on improving clinical reasoning pathways under time pressure, led to new frameworks for enhancing decision-making. Parental behavior. Insights into parental behavior highlighted emotional influences on healthcare decisions, urging a need for empathy in practice. Failures. Identification of silent systemic failures prompted urgent calls for action, focusing on the need for transparency and improvement. Calm is the beacon of hope for humanity. We appreciate your interest in Maya Cognitive Architecture, a transformative solution aiming to enhance clinical reasoning and improve patient care in the evolving healthcare landscape. Thank you. How does this kiosk work? Doctors download an application on their mobile to consult with patients when Dr. Maya refers patients. Patients use smartphones, kiosk computers, or laptops at kiosks in shopping malls, pharmacies, offices, villages, airports, and even at home. Consultation with Dr. Maya is done online through a screen. The kiosk also records basic vital signs and test results, including oxygen, temperature, BP, sugar, urine, and swabs. They can get laboratory tests were done and the results were discussed. After hearing the story of the symptoms patient, Maya advises if the symptom combination is minor or passid, the call to speak to a doctor. Patients can get a printout of the prescription if the doctor authorizes it after speaking. Kiosks can be installed by people in our community, individuals, if the politicians and world leaders do not act now. We must do all that we can to prevent our loved ones and our own lives. Please scan the QR code, join my network, and help me make you shed tears of happiness. Thank you.